This is Dr. Daniel Paul, orthopedic surgeon with Easy Orthopedics, and today we're going to talk about, does a herniated cervical disc always need surgery? If you like this video, we put out new content weekly, so please like and subscribe. So, does a herniated cervical disc always need surgery? The short answer is no. So you may have gotten an MRI, you may have neck pain, and you may have found some herniated cervical disc. The truth of the matter is, almost nobody has a normal MRI of their cervical spine, except if you're like in your teenage years. Once you start getting even into your 20s and 30s, you're always going to find some level of disc herniation or something. So very rarely it's going to be read as normal. And especially as you get older, 50s, 60s and older than that, like the MRI of your neck's probably not going to look good, and you might not have any pain. So the question is, does it always need surgery? No, it doesn't. So when does it need surgery? So sometimes, like I said, if you get an MRI of someone's neck, you're always going to find some small disc bulges. The questions are those disc bulges important or are they not? So when they are, it's normally when they're bigger and when they're pushing on a nerve. And when it's pushing on the nerve or the spinal cord, that's when it needs to get taken care of. And the symptoms are as follows. So if it's pushing on the nerves that are leaving the spinal cord, you'll get pain traveling down your arms. It's called radicular symptoms, or if it's a really high herniated cervical disc, you can get pain kind of traveling up to the back of your head. Those are sort of less common, but you do see them. So that's sort of when, okay, you do have a herniated cervical disc and it is causing symptoms. And if those symptoms don't get better with surgery, with conservative care, then you do surgery. The other instance is if it's actually pressing on your spinal cord itself. Usually it'll cause problems with like handwriting or like buttoning buttons or like fine motor movements and actually affect how you walk. If you have that, it's called myelopathy, and yes, that's like something that needs surgical urgency. Not like you have to go to the ER, but you got to get that done much sooner rather than later. If you let that sit around for a while, it can end up leaving you with permanent problems. Meanwhile, boy, if it's just pain going down your arm, you can kind of take care of it like less urgently and you'll do all right. So is a herniated cervical disc, basically the story is, everyone's always sort of going to have it, and if it's pushing on a nerve, it's causing pain down your arm, then it's significant. If it's pushing on your spinal cord and causing you to have trouble with fine motor movements, then it's very significant. You basically need to get it taken care of. So I hope I was able to answer your questions about when a herniated cervical disc needs surgery and when it doesn't. If you have any questions I didn't answer, feel free to leave them in the comments below and I'll do my best to respond. But we can't give you any specific medical advice over YouTube because this video and all my videos are for educational purposes only. Thanks for watching.